All right. This is our last scenario. And all right, guys, y'all did great. We left off a Z code, but we're going to talk about that. But let's talk about everything else right now. We have a pre and a post operative diagnosis of atrial fibrillation with Sick Sinus Syndrome. We have a procedure documented as insertion of Medtronic's in rhythm dual chamber pulse generator pacemaker, and it provides the model number with atrial and ventricular leads under fluoroscopic guidance. So all of that is important in capturing your code, which all of you did correctly. So let's talk about the indications. What are we looking for? He documented this. Now, even though these are taken from educational material, keep in mind that they're pulled, when they put this educational material together, they pull it from actual op reports and scenarios. So this was good to me because it says indications. I'm used to indications being something that you see at the beginning. This physician actually addressed what he did. So we want to make sure that we read the chart and read it with a, is it past or present tense? Will be something that you'll need to determine when you're reading out the physician's notes, because he actually included this in his operative report. It tells us this is an elderly patient with atrial fib and Sick Sinus Syndrome who had a dual chamber pacemaker placed with a screw-in atrial lead in the operating room. During the time of implementation, the permanent lead parameters were recorded in the patient's record. The entire procedure was performed under fluoroscopy. The patient has been on Coumadin for several years, but we encountered no problem with blood loss. The patient tolerated this procedure very well. I highlighted Coumadin because that's a blood thinner. And the fact that this patient was on Coumadin or any blood thinner before surgery is important for the physician to know, because even though this might have been a planned surgery and that physician could stop Coumadin the day before, you still got to be ready for blood loss. You've got to be set up in your mind in that OR to watch for any abnormal bleeding. So that's important. So we could read through our procedure description, and we are going to come out with our CPT code as 33208. Pacemaker with leads and insertion lead. Everyone got that correct. Before we go over the diagnoses, any questions on the procedure? You did very well. Okay, let's talk about our diagnoses. I want to look at some definitions here. I want to look at the definition of Sick Sinus Syndrome, and I want to look at the definition of atrial fibrillation. Sick Sinus Syndrome is a disease in which the heart's natural pacemaker, located in the upper right chamber, also known as our right atrium, becomes damaged and is no longer able to generate normal heartbeats at a normal rate. It is also known as sinus node dysfunction. You may see that in a chart documentation. Atrial fibrillation is an irregular and often very rapid heart rhythm that can lead to blood clots in the heart. You see these two a lot of times together. Think about it as diabetes with kidney disease. You're going to code both conditions because they're significant. Like the patient has the Sick Sinus Syndrome, and one of the manifestations of that could be the atrial fib. So I want you to think about why you would code Sick Sinus Syndrome and Atrial Fib because both of those should be coded. I-48.91 is the atrial fibrillation and I-49.05 Sick Sinus Syndrome. Both of these are definitive diagnoses found in our codes.
Is it I-49.05 or I-49.5?
Ah, thank you. See, that was a typo.
Okay.
Thank you.
Thank you.
All right, let me go ahead and save this. See, I knew that when you go over, you can always, the second look around, normally you pick up. I didn't pick up. I-49.5, Sick Sinus Syndrome. Those are your two diagnoses. But then, you know how we code long-term anti-diabetic medicine? It's that code, that Z code, the Z79 category is not just for diabetic medicine. We also have a Z79.01 that identifies anticoagulants. You want to pick that up. That's very important in the care of this patient. And even though that's not going to deem you any financial impact as a provider, you want that in your chart, because if I left this hospital and went to another hospital, they could pick up my codes and automatically know that I'm on Coumadin or that I'm on an anticoagulant. There's others besides Coumadin. For the payer looking in at this, the payer is going to see what my diagnoses are. They're going to see what the procedure was done, and they're going to see that this Z79.01 puts the patient at a little bit of a higher risk, because we all know that anticoagulants, when a patient has surgery or even gets cut, the bleeding is more profuse. We bleed a lot easier when we're on anticoagulants. So we want to pick that up. I think that's the end of my wording. So I wrote a lot in this today, and I did it deliberately. So you can go back and read it. Come back to me with questions. I made a note to go look at that E43 in the language description in your Find a Code. I think there was a couple of more notes of things to look for. Do some YouTubes, understanding angiographies versus cardiac caths. Just a lot of notes I tried to put in here today. Any questions? And I will be sending over that article from CPT Assistant as well on your coding of adjacent tissue transfer. It's really good information, and the examples always help me. I always try to code it before I look at the answer to see if I can get it correct.
Will it be good for I to say that the last scenario comes in from internal medicine?
Let's go back and look.
Yes, the last scenario that
Number 5.
Coded. Yes. Will it be good?
It would. That's where you're going to see this most often. Yes.
Okay. It's all right.
You can also see this from a cardiologist.
Yes. Okay.
But you may see this in an internal medicine.
Okay. All right.
First, you're going to see it in a cardiologist. Second, internal medicine.
Okay.
It's going to depend on their dual role as a physician. They may have a specialty in cardiology. You won't see this in family practice.
Okay. All right.
Bless you.
So,
oh, I'm sorry. Go ahead, Michael.
yes. So the number 4 is still from the internal medicine or cardiology.
This is going to be this one. This again, let me explain something because that's a good question to bring up. These are cardiologies.
Okay.
But when you have an internal medicine physician with his credentials in cardiology, you're going to see this. Not
Okay.
often. Not often.
Okay.
These are mainly from your cardiologist.
Okay.
I don't know if we have any of these in our internal medicine. I can't remember. We might. We might.
I'm doing my calculation through the codes, the CPD codes.
Okay.
So from the tabla, that's where I now draw my analysis.
Yes. Good questions. Blessing?